Right, well, I'm Gillian Forsyth. I'm the Administration Manager for Primary Care, and I work closely with our public dental service and our public health colleagues. However, we are more to do with general dental services in Primary Care Department.
I'm Kieran Waters. I'm a general dental practitioner in Lanarkshire, and I'm also dental practice advisor to the Health Board. As with all aspects of healthcare nowadays, it's important that dental services are provided in premises that are fit for purpose and that can deliver care that's safe for patients. As with all areas of healthcare, dental care has advanced considerably in the last decade, and in the same period patients' expectations of care have risen considerably as well. It's important that dental care can be provided in premises that are fit for purpose, where there's access to all groups of patients. The Scottish Government has provided funding through a number of initiatives to support practices in improving premises, principally the Primary and Community Care Modernisation Programme and the Scottish Dental Access Initiative. In Lanarkshire we have involved dentists and their staff at an early stage to try and use the funding that we can to help them move premises, improve premises, or extend premises.
Well, historically a lot of the practices have been located upstairs in old tenement buildings or converted flats and houses, and limited space. The need for having a separate cleaning and sterilisation room put a further pressure on practices. This caused a few problems for where they were actually located. So we applied for funding through the Primary Care and Community Modernisation Fund and helped 16 practices either relocate, expand or to renovate their premises to make them more fit for purpose.
If practices couldn't find space to have a separate room for cleaning instruments, potentially they could have to close. Also, we have an ageing population that are keeping their teeth throughout their life, and premises where upstairs, one or two flights up, can be difficult for them to access.
All dental practices are inspected every 3 years using a nationally agreed report template, and the practice inspection programme, amongst other things, ensures that certain standards are being met and the teams are meeting health and safety requirements. They are continuing with their professional development to control cross-infection contamination, and also to prevent unnecessary exposure to radiation. So this aims to ensure that patients receive care that's appropriate in a safe environment and fit for purpose premises.
The new combined practice inspection requires satisfactory completion. To get this, practices have to comply with all the requirements that are set out in the document. We've delivered a number of training events to help them with this, and we've produced a resource that contains templates for all the policies and protocols that they're going to need. There's still a lot of work for them to do in completing them for their own practices, but it's given them some support and help in putting things in place. Hopefully it's taken some of the stress and workload away from them.